Hi, everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. This is another Q&A series that gets released on Mondays. This is where I answer your specific and direct questions. That's right, your specific and direct questions. And if you have any questions for me in regards to anything that is happening to you in regards to gender dysphoria, in regards to any struggles that you would like to have answered tailored specifically to your case, feel free to email them. My email is below in my information box, as well as you can go ahead and just comment underneath this video and post your question. Keep in mind, your question cannot be diagnostic in nature. As long as your questions are general enough that I can generalize to the whole public, I can go ahead and answer them. As always, if you have posted your question and I have seen your question, you would have gotten a response from me that it's a great question. I'll do a Q&A on it. And if you posted it and you have not got response from me, please go ahead and email a question to me. Perhaps I just somehow missed it, and I apologize for that. Having said that, let's dive into our questions today. There is always timestamps for you to follow in case if you just want to jump around, and I have blocked out everybody's name for privacy. So first question for today. I'm at a Christian conservative college and they're gatekeeping paying for a gender therapist behind 2 sessions of conversion therapy a week. What's the best way to survive the 2 sessions? First of all, I'm so sorry that you have to go through conversion therapy in order to get the gender affirming care that you need. Having said that, I'm even really shocked that people are still doing conversion therapy, although I'm not that shocked, but I am shocked nonetheless. So how do you survive it? So first of all, let me tell you this. What is your goal? Is your goal to see gender therapist because you're questioning your gender identity, or is your goal to see a gender therapist so that you can get hormones and you're ready for hormones? 2 different things. If you know your gender identity and you are adult and you want to start hormones, there are informed consent clinics, not only probably in your state, but also online, where you don't have to jump through these hoops. If you want to engage in gender therapy in order to explore your gender identity, and this is the hoops you have to jump through, also try to see if there's maybe therapists online, gender therapists online, that you can just see. I understand because you're in Christian college, you may be using your college insurance, and this is where your limitation ends. But if that's not the case, and if maybe you do have funds to see another therapist, I really encourage that. So in other words, see if you can do all of those things in order to avoid going through conversion therapy first. If you absolutely have to go through conversion therapy in order to get to a gender therapist, and this is a hoop you have to jump through, unfortunately, this is a hoop you're going to have to jump through. I wish I had a better answer. But a lot of viewers, a lot of members of your community who are watching this knows that they all have hoops, and it sucks and it's not fair. So if this is hoop for you, how do you survive those 2 sessions? 2 sessions is 2 50 to an hour minute sessions. First of all, you can do it. Second of all, I'm not sure what conversion therapy is going to entail. I don't even know how they practice the modality. Is it just talk therapy? Is it just basically telling you that this is really not gender dysphoria you're feeling? Is it, I don't really know how the nature of it. Assuming that it's basically just having you question your own belief in your subjective reality, how do you survive it when you absolutely have to? Get a support system. Get somebody, a friend, a family member, maybe an online person that you can just connect to after having the therapy and discuss, vent, just explore what happened, process what has happened. But going into this therapy, just be yourself and be honest. You are who you are. You know who you are. I don't think the 2 session conversion therapy doesn't do shit. I'm sorry. If you're trans, you're trans. 2 sessions definitely not going to do anything. 20 sessions not going to do anything. So if you are concerned about your survivorship of the conversion therapy because you're afraid that it is actually going to convert you, don't worry about it. But if you're afraid because you feel like it's going to be traumatic, then I really apologize. And I really don't know how they practice this modality. Obviously, I am very much against conversion therapy. but do try to get support systems. The support system, in order to survive it, is going to be your best bet. And again, try those first things that I mentioned in the beginning first to see if you don't have to jump through that hoop. That would be the bad thing. Hopefully this helps. I apologize. I wish I had a better answer for you. Second question. Hi, Dr. Z. Your videos have been so helpful to me. Glad to hear. I'm 65, soon 66. Began seriously struggling with my gender identity about 6 to 7 years ago. Since my wife passed 5 years ago, I'm really sorry for the loss of your wife, and I hope you're taking your time to grieve her loss. I've been having depression and anxiety. I want to understand better what the dysphoria feels like. Like today, I had put on little makeup and dressed feminine for the morning at home. Now I have to go out, but must present as male. I feel anxious and upset that I must do that. Is this a symptom of gender dysphoria? And sometimes I just don't want to get out of bed and face the world male anymore. Because when I have gone out, either shopping with friends or to club for drinks, feminine, I felt wonderful. Sorry this was so long, not long at all. Thank you for all you do. Great question. So you basically what you're saying is this. I've been questioning my gender identity 6 to 7 years ago, which puts you at around very late 50s, early 60s. When your wife passed away, the symptoms of depression and anxiety have gotten worse. And so you're basically kind of wondering, hey, what the hell is going on here? Based on what you shared, first of all, I want you to be mindful and pay attention to how you are being very gender specific in what you're sharing. There's a clue here. You're saying that when you are at home and you are presenting in feminine, when you embody the feminine, you feel amazing. When you realize you have to go outside and you have to present as male, you suddenly feel anxious and depressed. Additionally, when you've been shopping or been out with friends in feminine mode, you felt wonderful. These are all gender-specific clues. Now, for sure, the loss of your loved one could lead you to experience depression and anxiety. How could it not? And you could be also experiencing depression and anxiety on top of also what sounds to me like gender dysphoria. Why am I pretty confident saying this is gender dysphoria? Because it's so gender specific to how you feel. This is big chance this is what's really going on. Now, if you really want to clarify, best would be to do two options. One, seek out a therapist in your area and explore further. If you can't find a therapist in your area, your second option is going to be to observe and pay attention. Start documenting, start journaling. 9 times out of 10, oh, look, there's a pattern. When I present as a man, I feel anxious and depressed, and I feel really bad. My mood suffers. 9 times out of 10, when I present as a female, when I'm in feminine, I feel amazing and good, and my depression, anxiety goes away. These are clues. Pay attention to them. If they're gender specific to your gender, chances are that dysphoria, this is how dysphoria likes to dance around. This is how dysphoria tends to manifest. So pay attention to those things. But this sounds quite gender specific to me and most likely is a dysphoria, but I would definitely collect more data, spend more time with yourself, or seek a professional who can actually properly confirm that that's what's really going on. And I wish you all the best. Good question. Next question. Thank you for this video, Dr. Z. I have been on and off hormones due to finances. So common for so many of you to be on and off either finances or gender affirming care, where you at is getting more restricted, and a lot of you are yo-yoing, which if you know me, I don't like when people yo-yo on hormones, but I also understand that life can present challenges where your only choice is to yo-yo. At times I go through denial and believe I can go without and not go through transition due to a few factors. After a few weeks of not taking HRT, I slip back into depression and I have discomfort and I struggle to look in the mirror. I become insecure, negative, and extremely pessimistic. I start struggling with relationships and my energy dips. My frustrations and tolerance get worse and I find it difficult to cope. The denial gets worse and my confidence, self-worth, and self-esteem deteriorate. I battled with this all my life, even with being on psych meds. Is this a common situation for trans individuals in your experience? I hope you can shed some light on this. Thank you once again. What a good question. And guess what? I have shitload of answers for this question because I see this so many times. Why? Because I see so many people get on hormones and then stopping hormones for a variety of reasons, finances being one of them, not being ready to come out, thinking that you can, just like you, believing that you can make it without transition. And what happened to you happens, I would say, in 90% of the cases that I see. The minute you stop taking hormones, you start to feel worse. Why are you feeling worse? The reason why you feel better, first of all, let's go back. The reason why you feel better on hormones is because you are getting hormones that is right for your body, one. Two, you feel like you're finally taking control of gender dysphoria. And three, you're actually alleviating gender dysphoria. So those three main reasons are helping you to feel better on hormones. The minute you stop taking hormones, if you are the person that actually does have gender dysphoria, this is exactly what's going to happen. You're going to start feeling worse. Then you're also going to have all the symptoms and you psychologically going to suffer. Yes, you will be feeling pessimistic and cynical and you will be feeling negative and your relationships are going to suffer because you are not acknowledging who you are, because you're not accepting who you are. What I see in your sharing is what I sense is resistance to acknowledging that, yes, I'm trans, resistance to acknowledging that you're struggling with gender dysphoria and accepting that transition perhaps is the only way for you in order to alleviate gender dysphoria. That acceptance is so difficult for so many people to make because that means you have to embrace everything transition brings. And transition brings good and bad, right? Because going through transition is difficult. It's not a walk in a park. Anybody who watching this who has transitioned or is going through it knows exactly what it is. It's a serious decision. But instead of yo-yoing, I want you to notice that the huge discrepancy between how good you feel when you are taking care of yourself and how bad you feel when you're not taking care of yourself. If that duality is not enough for you to make a decision in order of what works best for you, try to work with your resistance, because this is our resistance that keeps us, and our mind also that tells us that, oh my God, maybe I can make it without hormones. And this ends up being a good test for a lot of people. A lot of people who have yo-yoed know this. They also thought maybe it will just go away, and then they stop taking hormones, and they feel, not only they feel increase of dysphoria, the dysphoria tends to be even worse. And the reason why it's even worse for you, chances are, is because you have experienced feeling good, and now feeling bad is amplified because you have that point of contrast. So work on your resistance, and I would encourage for you to, the yo-yoing is really hard on you. So wish you all the best. Really good question, very common, incredibly common. So those who are watching have been in the shoes, comment below, let this person know that they're not alone. Very, very common. Next question. I have taken some steps to coming out. Congratulations. My family knows and they have been great to me, but I still feel guilt and I do not know how to deal with it. Guilt is going to be so common for so many of you. And you feel guilty for lots of reasons. I've done videos on shame and guilt. I would encourage you to watch it. I also just released a video last Thursday of this date. Today's March 1st. So last Thursday, February, released a video of, oh no, I'm sorry. This is the video that is going to come out March 16. I have it planned, scheduled for March 16 to come out. This is the video where I talk about why so many of you tend to be self-hating towards yourself and self-loathing. And it will explain a lot why you also feel guilt. But to give you a short synopsis, the reason why you feel guilty is because so many of you have been taught to believe that you're not deserving of being your authentic self, that your authentic self is not something that is lovable or worth it, or has a sense of value. Another reason why you're feeling guilt is because you are feeling responsible for how everybody else around you feels, whether you realize it or not. And you feel like you're going to make people uncomfortable, where I heard this again and again, where people say, oh, I don't really want to impose my pronouns because I don't want people to feel uncomfortable. you're not making people uncomfortable. You're not imposing anything. I mean, for fuck's sake, it's pronouns. It's no different than if I got divorced and I'm just letting people know my last name has changed, which, wouldn't be the case because I kept my last name. This is how territorial I am for all of you who know me, probably sense that about me. But guilt is going to be inevitable. Work through the guilt. Try to break down what is it that you're feeling guilty about. Why is guilt is eating up at you? What specifically makes you feel guilty? Does it make you feel guilty to own who you are? Does it make you feel guilty because you feel like people around you, your families that knows and that supports you and accepts you, are the ones who now have to adjust? We're all changing. Things change with us all the time. So we're all constantly adjusting to things. You owe this to yourself to be happy. This is your fundamental right. You owe to yourself to be you. So start to massage that guilt, but it's normal. A lot of you feel guilt, but absolutely nothing you should feel guilty about, but try to work on it. Hopefully this helps. And I will try to remember to link the videos on shame and guilt. Next question. Good morning. Can you explain when or how to get over the burden of shame and guilt? Okay, I didn't even realize I had two questions because I randomly picked them. Okay, I rarely leave home. I associate with no one. I gotta say, that is quite really, there's a lot of isolation here. If you're completely isolated, not only do you not leave home, but you don't associate with anyone, that's incredibly hard on your overall psyche, on your self-esteem. Remember, we as human beings are relational. We're meant to connect. We're meant to exchange. We're meant to dialogue. We're meant to see each other. We're meant to converse. Not to be able to have that is very, very challenging. You don't have to be in a relationship or married to get the relational aspect into your life, but it is very essential to your well-being. I had no idea that transitioning would be a prison sentence. I'm afraid of the world and what its people think of me. I live in Texas, and for some reason, transgender individuals are at the top of the list. Yes, and in a lot of other states too. If the state's agenda, if the state's agenda problems and now have become a topic for every church denomination. Sorry, I don't know why I can't suddenly read. I think I'm thinking about Texas and other states. How can I be a normal person in society when society despises me? Thank you for what you do. So the reason why I'm pausing is because I'm hearing so much in what you're sharing is this very big personal wounding and trauma. It is hard right now for a lot of you. Texas, other states, even liberal states, in terms of people, suddenly feel like the right to just openly say horrific things. You said that you feel shame and guilt. And then also what probably amplifies your feelings of shame and guilt is that the state you live in, the state that you call home, is doing a lot of things that indicate to you you're not welcome there, that indicate to you you're not wanted there. And that's really, really hard. And it's also safety concern, right? Here's also safety concern of going publicly and being afraid that something might happen to you. Safety concern always the first. If safety is an issue for you, I don't blame you for isolating, and I totally understand. Now, safety concerns are a lot of times can be real, and a lot of times they can be amplified by our own internal fears. But in reality, our safety is perhaps not as threatened as we perceive it to be. To distinguish which one it is a tough call, and you have to be realistic about the state you live in, and you want to be safe. My immediate question to you is, can you potentially relocate? And I know it's like a band-aid, but it will help you tremendously to be at least in an environment where you feel more safe to publicly live your life to some lesser or greater extent. Isolation is horrible. I would really encourage for you to start connecting, connecting online. You have a computer, you were able to contact me. I really encourage for you to look up groups, support groups, Facebook private groups, other social media. Start connecting with people. Start connecting with people in your state who feel this way. Start discussing, opening up, and talking. And maybe somebody else is going through the same thing, and suddenly you don't feel alone anymore. Suddenly you feel like you're not the only one bearing this horrible thing. The shame and guilt you feel is by far is not yours. It is so amplified by society, and it's so amplified by the state you live in and what the state is doing right now. Try not to internalize it as yours. It is not yours. Society doesn't despise you. It may feel like society despised you. Texas may feel like it despises you. And yes, there are people in Texas who may feel like you have no right to express your gender. And there's a lot of people in Texas who either don't really care and think you should do whatever the hell you want to do with your life. And there's a lot of people in Texas who do care and think you have every right to express who you are. So be careful not to drop into all or nothing thinking. The world feels bad, but it's not all bad. There's really people who try to help to try to make change even in your state. So I wouldn't suggest for you immediately to work on your shame and guilt. What I would suggest in your situation is to immediately work on decreasing your isolation, connecting with somebody else. And also see, can you engage in a therapy with somebody? Are you able to seek out therapy? And if you are, talk to a therapist, start unburdening it, and also have therapists help you understand how safe or unsafe your environment is. Perhaps it's really amplified by how you feel and you actually can't go out. But again, if it's not and it's real, then yes, safety is always concerned. I wish I had something better. I wish that Texas would do better. I wish that other states would do. I wish that we as humans would strive to give each other dignity and respect we all deserve, instead of superimposing our individualistic beliefs when it comes to something so personal and so individualistic as your sense of self. So I wish you all the best. And anybody who is watching this, if you're in Texas and if you would like to connect with this person, comment below, let them know that you are also in a similar situation. We're all, like I said, we're all starving for connection, and I really encourage any of you to basically connect on through the community and this channel. So I wish you all the best. Okay, last question. I've been accidentally misgendered by people who met me after I transitioned. They first met me as a woman who uses she, her. I've been on hormones for 10 months and I don't fully pass. I get called she, her maybe 25% of the time by people in public. It's still extremely frustrating getting even accidentally misgendered by people who have known I'm trans and use she, her from the moment we met. It makes me feel really dysphoric because apparently I'm still seen as a man to people even though they know I am trans. It feels even more invalidating because they know. How do I handle those situations and feelings? I'm sorry this is happening to you. Misgendering is painful, and it's almost like into accumulating this micro trauma again and again and again and again, no matter how strong your confidence and self-esteem is and how good you feel about yourself. Misgendering hurts, and it's impossible not to feel hurt by misgendering, because just the nature of it invalidates your own perception of yourself, invalidates how you see yourself, invalidates so many things about yourself. So it hurts no matter what. And it is hurtful when you meet people and you let them know and you express your gender identity and they continue to make mistakes. You mentioned pass. I'm assuming passing something that is important to you. Again, passing is not important to everybody, but it sounds like to you it is. 10 months is, can I just say, 10 months is young. Don't be so hard on yourself. I hear you being so hard on yourself. 10 months is, it's nothing. I'm so glad you are 10 months in the hormones. That's great. But as anybody watching can tell you, 10 months is not going to like create miracles and modify all those secondary sex characteristics that got influenced by years and years of testosterone. It just doesn't work like that. I did a video, I'll try to link it below, on how can you capitalize on being misgendered. And what I say in that video is that if your goal is to pass, and if you continue to get misgendered, yes, the pain is going to be there. Try to look at it as a set of data points. What is it telling you? In other words, what is it that you may feel like you need to work on, that you may not be working on? Can you find somebody you're close to that you can ask and get objective, honest feedback about? Again, passing is not everybody's call. But if it is somebody's call who's watching it out there and you're going out there and you get misgendered, then it's like data points, because people who are misgendering you, I get a feeling from this, they're not doing it on purpose. I know they know and they should respect you, and most likely they do respect you. People are, we're such slaves to our conditioning. We don't even realize to what extent our brains are slaves to conditioning. Myself is that example. I work in this field and I am very careful with the language. Nonetheless, it's even sometimes when I go out and I see a person, I don't know what their gender is, I have to remind myself to be genderless. I have to remind myself to be genderless with even people who I assume what their gender is, because I know it may not be the case. And that's hard to do. It's deprogramming what you've been told. These individuals, just like the rest of us, will look at people, and our brains are like computers, scans the person immediately, and within milliseconds, the brain makes decision whether that person in their perceptive eye is male or female. It shouldn't work like this, but this is how our brains have been conditioned socially. So people will blur out without even realizing. Now, if people are misgendering you who know you, and then they catch themselves and they apologize, that's a good sign, in a sense that they didn't really mean it, obviously, to hurt you. If they misgendering and not even apologizing, not aware, that's for you to decide. Are they being hurtful, or are they actually trying to do you harm? And then I would say set boundaries with those people. But it's hard, you said that you pass, what you say, 25% by the public. That's fantastic. 10 months, that's great. Don't let it beat you down. You know who you are. Remember, a lot of you are evolving into who you are. That evolvement, it doesn't happen overnight. Give yourself time. See what things are within your control to be able to improve on. And yeah, and things will start getting better. For some people, like I said, who don't really care about passing, they also don't really get affected by misgendering, because passing is not their goal. But if passing is your goal, see it as a data point. So hopefully this is helpful. I apologize that this is happening to you. It sucks. I always say that misgendering is like you going out there and you get invisible punch into your stomach again and again and again until you get punched. It's like life is a boxing ring, and misgendering is a punching, it's the opponent that constantly hits you down, and it's hard. So don't be then additional puncher to yourself. Don't be hard on yourself, is what I'm saying. Don't then come home and also start beating yourself up for not being good enough. No, if this is your goal, okay, so what can I do to work on it? So what do I need to implement? What's not working? What's working? And I think that's going to help you in terms of the situation. These are great questions. Thank you, everybody else. I have more. I'm excited to do this Q&A. As many of you know, I am loving it. So please feel free to post your questions, to email your questions. And I hope these answers are going to help those individuals who ask them. And I hope the answers are going to help everybody else. So comment below, let me know. Love reading all of your comments. And I will see you all next time. Bye.